On here with one of my colleagues today, Emily Hodgkins, but my name is Patrick Cavanaugh. I am the Public Information Officer for the Division of Emergency Services and Communications, or New Hampshire 911. And Emily, I'll have you introduce yourself as well.
Hi, yes, I'm Emily Hodgkins. I oversee the 911 CARES program for our division.
Yeah, absolutely. So we'll walk you through. First, I'll talk about some generic 911, and then we'll save time for Emily to talk about the important thing, the topic here of discussion today, the New Hampshire 911 CARES program. So let me first start. Let me share my screen. All right. Can everybody see the PowerPoint? Perfect.
Yes.
All right. Thank you. All your faces went away when I shared, so thank you for letting me know. All right. So, talking about New Hampshire 911 CARES, we'll dive right in with the generic 911 side to start. So 911 in New Hampshire is completely funded by the telephone surcharge. So every phone line in the state of New Hampshire, and business phones up to the first 25 lines, have a 75-cent surcharge that funds all of what we do here at the Division of Emergency Services and Communications. So that's everything from the 911 call takers or our telecommunicators, all the way down to what funds the employees like Emily who work through our New Hampshire 911 CARES database. So it's not taken from the governor's general fund, it's taken directly through the surcharge. Our call volume, we take about 13 to 1,500 calls per day out of 2 call centers or public safety answering points. We call them PSAPs. So between the two, one in Concord and one in Laconia, we take about 13 to 1,500 calls a day. That evened out to about 470,000 calls per year last year. Our busier time of year is in the summer months when we have more tourists and visitors to the state. But this time of year, we land right around that 1,300 mark. As you can probably guess, cell phones are the predominant way that we receive our calls, greater than 80% now, and that number grows every year. And one thing that a lot of people don't think about, so I include this in our presentations, is multiple calls that we receive for certain emergencies. So it jumps in very quickly, but I wanted to put it there just because we have about anywhere from 8 to 15 call takers on at any given time across the day. So we are here 24/7, 365 days a year. And with only 8 call takers on an overnight or 15 on during the middle of the day, one rollover crash on I-93 could put us into what's called queue, where more calls are coming in than people that are available to answer the calls in our PSAPs. So I always, encourage people, of course, to report emergencies. But if we tell you we are already aware of the emergency, that means that we are closer to the emergency or closer to the patient if it's a medical emergency. I always touch on that because we are never going to rush somebody off the phone when you call 911. So if we tell you we're already aware, we're already close to the emergency, we're probably just letting go of the calls that are just the passersby that are reporting the emergency. So we're never going to hang up on you or rush you through the call. So that kind of closes the loop on maybe some experiences people may have had calling 911. So more than 99% of all calls that come in for emergencies in New Hampshire are answered within the first 10 seconds. This beats the industry standard of about 85% of those calls being answered within the first 10 seconds. Our 911 dispatchers go through 16 weeks of training before they're taking calls on their own. And what this means is, from a customer service standpoint, you will never get telecommunicator who's answering their first call on their first day. That 16 weeks can be classroom training, getting their certifications to answer those 911 emergency calls, getting their emergency medical dispatch certification. So 16 weeks ensures that they are not only comfortable taking the calls for emergencies, but again, you're never getting somebody who's inexperienced or unprepared to take that 911 call. So how does it work? So in New Hampshire, 911 works very different than almost all of the other states in the United States. Rhode Island does a similar structure where they have centralized 911. And what that means is, while we have two physical locations, Rhode Island has one. All of the calls go through just those two places. For example, Massachusetts has over 217 911 call centers, so it's a little bit more localized, geographically. In 911, I'm sitting right now in our Concord building with a 911 call center right downstairs, that middle picture that you see here on our screen. If I called 911 from where I am sitting right now, that does not guarantee that I am going to get the call center downstairs. So the way that 911 calls are routed in New Hampshire doesn't mean you're going to get somebody that's close to you or somebody that's not in your town unless you live in Concord or Laconia. So right now there would be a 50-50 chance of Laconia or Concord picking up if I were to call. So the way that the calls are routed are they go to the next available call taker, again, that photo you see in the middle, who's been waiting the longest since their last call. So you can never depend on the telecommunicator knowing, the small detail, the small details or the landmarks of your town. That information is still helpful because we will pass it along to the local responders. But again, don't expect somebody from your town to know exactly, some of the non-address descriptors that you may provide. So to walk you through how a call works, so it starts with an emergency. In this example, we'll say somebody's in cardiac arrest. They call 911. Again, that goes either to Concord or Laconia. And we are providing that information through those 4 computer screens that you see in front of that middle picture. We are talking to what's called local dispatch or a local dispatch center. And every town and city in New Hampshire has that local dispatch. So think of 911 as staying on the line, focusing on the caller in a medical emergency, but providing that information not only verbally, like you may hear on a 911 call, but through the computer as well. So there are towns and cities in New Hampshire that take that information as a pre-alert is what it's called, the information that they're receiving through the computer when we get that call and we know the nature of the emergency. And they're sending the ambulance already on the way while you're still talking with the 911 dispatcher. So I'd say the most common complaint we receive in a medical call is somebody saying, why are there so many questions? Just send the ambulance. When the reality is answering the questions isn't delaying help. That ambulance is likely already on the way. And really, the more information you can provide, particularly around the nature of the emergency and your location, is going to help get that ambulance, police cruiser, fire truck to you faster. So always provide the most information you can, particularly around location, when you call 911. So again, I already spoke to this, so I'll breeze through this so that Emily can talk more about CARES. But our 2 call centers or public safety answering points are located in Concord and Laconia, just a quick 26-mile trip up the road, so that there's redundancy there. Anything from a catastrophe in either facility, it would be easy to ship all of our call takers to one or the other if the ability to take 911 calls went down in either facility. So there are redundancy or backup plans on our call centers as well. So we now have mobile call taking units, or a trailer of those call taking units could be deployed should both of our call centers to go down. So in theory, 911 should always be available, even if both of the structural buildings that we're located in are under disaster or distress. Again, with this group, I'm sure it goes without saying, but calling for emergencies, staying calm to the best of your ability, and do not hang up even if you dial accidentally. So with more of the smartphone features these days, we're getting more accidental calls than ever. And of course, human instinct is to hang up as fast as you can. So try to fight that and stay on the line. Let them know that there's not an emergency, and that ties up less resources, because with that abandoned call, we will try to call back or even text back to make sure that there's not an emergency. Looking for things. So I talked about landmarks earlier. So location is the most important piece of information we need to get help to a 911 caller. So looking for information such as cross streets. If you're in a multi-floor building, what floor you're on. For moving emergencies, we look for mile markers. You'd be surprised how many people go hiking when it gets, a little bit warmer and have no idea what trail they're even on, as well as those local landmarks as well. The local landmarks can really help the local police and fire departments, local ambulance crews find that emergency, even if the 911 telecommunicator isn't exactly aware of where that landmark is. So it's not like the movies, the way that we map all of our 911 calls. So we're using the cell towers and triangulating that location. So sometimes we don't always have that accurate picture. One thing I'll also talk about is our text to 911 capability. I'd say this has been around since 2015, and I'd say 8 out of every 10 people I talk to still don't know you can text 911 in New Hampshire. So we always say call if you can, text if you can't. Texting is a great option when there is poor cell service or low battery on your phone. It takes less signal and less battery strength to send a text than make a phone call. And we always tell people to lead with their location when sending a text. If it's that last text you can get out before the battery on your phone drains, at least we'll know where to send emergency crews. So again, call if you can, text if you can't, and please, the one ask I have of you today is to tell people of these very important resources available to them. The 911 Cares program, which Emily is about to talk to you about, and text to 911. We still encounter a lot of people who have no idea about these programs. So that was more about text to 911, and I'm happy to provide a copy of this slideshow as well so that you can have all of this information. This really just talks about how to send that text, putting 911 in the to field, and then some of the nuances. So we cannot accept photos or videos or emojis or the location pins that have been more popular now with the smartphones. And that's not because we won't utilize them. It's because our texting system does not recognize any of that information. So right now it's text only when you dial or text 911. So I spoke to the accidental calls earlier on, really trying to power through this. So Emily we can talk to our subject matter expert on 911 cares. Lastly, I'll finish up with just giving another plug for how you can dial 911 if you need to quickly in an emergency. So the emergency button, this is an example on an iPhone. On the password screen, this is also an option on an Android. I should probably add that to our presentation. But that emergency button brings up a screen where you can dial 911. Clicking that emergency button in this particular instance here would not call for you, so feel free to check that out if you're unfamiliar with that. So it's not going to automatically call with this particular example. So clicking that emergency button would bring up a dialing screen similar to how you would place any other phone call on your cell phone. And that doesn't work for there's not emergency contacts you can assign. You can't call your spouse or your children or family members. That is specifically designed to be able to call 911. All right. With that said, I tried to power through quickly. That's a lot of information in probably 8 minutes. But I'm going to turn it over to Emily, who can talk more about our 911 Cares database.
Thank you, Patrick. Good morning. So New Hampshire 911 Cares is the Citizens Assistance Registry for Emergency Services. I'm just going to call it CARES going forward. It's not as much of a mouthful. So this program was specifically set up so that if someone has a health condition that drastically impacts how the 911 dispatcher will handle the call, they can register their health condition, their address under their phone number. So if that person calls 911, the dispatcher will have their name, home address, and any medical conditions. Um, so this program has been around since the early 2000s. It was previously called Supplemental Alley. Within the last 2 years, we have revamped it. We've made it 911 Cares so that it is now all online. So you can go to cares.desc.nh.gov and it will bring you to our page. So when you go onto the page, you can either log in or set up a new account. You can register multiple people. So when one of the two words are account holder and cares individual. So the main difference is the account holder is the person who is setting up all of the cares. Account holder information does not show to our 911 dispatchers. So if you are setting up an account for yourself, you are going to have to enter your information twice. You'll have to set up your information as the account holder and then again as the cares individual. So for the next slide, we'll just go through setting up that process. Email, password, very straightforward. As far as setting it up, you will have to go through a multi-step process. So you'll receive an email from New Hampshire View. This will give you instructions to complete the login. After you get this email and click the link, then you can go back in, log in, enter your email and password again, and then you'll be able to start setting everything up. So it is multiple steps, but once you see this page, the Welcome to New 911 Cares, you're on the right track. So the first thing that you'll set up is, again, the account holder's information. If you're setting it up for yourself, you just put in your information. If you are a healthcare provider, you can set up your information and then register your patients. If you have family members, you can register them as family members as well. So then it's just the one page of information, then it will take you to setting up the cares individual. So the information that we need is full name. We do need date of birth, the dispatchers. It is important for them to know the age of the individual. And then street number. So we ask for the home address, not mailing, not work. We want the home physical address of the individual. And then on the next slide, this is our list of pre-approved conditions. So the three that are checked, behavioral concerns, medication allergy, and other, you will have to enter additional information for those three. The rest, if you're just registering someone who, say, is deaf, the information will go right through and will automatically be approved. For these three, we do have to review it just to make sure that the medication allergy is there, is listed, and behavioral concerns, that all of that information is listed for our dispatchers. You can also, we do have the other option if there is a medical condition that isn't on the pre-approved list, but you think it should be registered, we encourage you to click the other box, register it, and then our team will review it and most likely approve it. And then the next slide. So once you register, the patient's information will be there. You'll want to click the add phone number. You can add as many phone numbers as you would like to the person's account. So if they have a couple of cell phones, a home phone, landline, you can register all of those. The other thing is if you're registering two people in the same household and you're using the same number, you can use the same phone number for multiple people as well. One thing just to note, Patrick did mention about texting 911. The texting service does not connect with CARES. So if you text 911, your CARES information is not going to come up. We do recommend still registering. So if you call 911, the information comes up. But if you're in a situation you have to text, you will have to provide them your address and everything because the information, as of right now, the two systems do not connect to each other. And then on the next slide, CARES registrations now have an expiration date. So before with Supplemental Alley, once you're registered, you were always registered. We have put an expiration date of 18 months on it. This will, just so that we make sure our dispatchers have the most up-to-date information. So at 17 months, we will reach out to the account holder, let them know that the CARES individual's information is getting ready to expire. It is very simple. You just log on to your account. You can revalidate the information. It's good for another 18 months. We also, if we notice it hasn't been renewed, we'll reach out at 19 months just to let you know that the information has been taken out of our system. You can still, after the 19 months, log on and revalidate the information. So if you go past that, say it's 24 months in, you can still renew that registration. Um, the next slide, I believe, yes. So one question that we do get frequently is, what if I don't have an email address or access to online? We recommend that the individual have a family or friend register for them. But if that is not an option, you can fill out the paper form, which we can mail to you, or it can be printed from our website. And if you send that in, we will still register you. So even if you don't have an email or access to an email, you can still use 911 Cares, and we'll just monitor the account. They still expire at 18 months, so instead of getting an email, we'll give you a call and make sure that the information is still valid. And then I believe we do have outreach material that can be printed from our website, or we can also send that to you if you are interested. But that is everything that I have for CARES. Do you have any questions?
I have one question. This is Emily. On
Yeah.
that sheet, it said LVAD as one of the things to check. What does that stand for?
I am not sure of the full term LVAD, but it is a heart machine that if you have an LVAD, you actually don't have a pulse. So it's important for the dispatchers to know if the person has an LVAD, because if somebody comes up on someone and they're not feeling a pulse, it could just be because of the machine, not because they're in cardiac arrest.
Thank you.
Yep, it's a ventricular assist device.
Thanks, Patrick.
You got it.
Thank you.
Any other questions?
What kinds of behavioral concerns are typical for this program?
Yes, so some of the common things that we see is with Alzheimer's or dementia, or if someone has autism, they can become aggressive or violent. The other thing is if someone has autism or um, something like that, that they have the sensory issue as far as lights or sirens. We recommend registering that, and you can put in other that the sound of sirens will agitate them, or however that affects them. That way, our dispatchers can relay that information to the town, to the local dispatchers, and they will know before driving to the house.
Thank you.
Yes. Were there any other questions?
I
Yep,
had a
Megan.
question. Oh, sorry. Go ahead.
We work with 19 towns. I'm just wondering, does every police department in New Hampshire know about this program? Are they all aware of it?
I'm not sure about that. Maybe Patrick has more
Right.
information.
So the
Just
answer to
because we
that
work with
is
so many communities, so I don't want to just keep sharing if they do know.
Yes.
hypothetically the answer should be they should. You know,
Okay.
we've done the outreach. It's not always received or received timely. But the messaging has gone out. We continuously communicate with we have field reps, so it's done a little differently. It's not my position that talks directly with the towns, but there is a field representative assigned to all of the towns and cities in New Hampshire. So that's where the in theory comes in. Obviously, some towns are a little bit more receptive and quick to receive our information than others. But there is that connection with each of the towns and each of the dispatch centers across the state. I see there's a couple of hand raised. Let me stop sharing so I can see who's got their hands raised here. All right, looks like there's one person with their hand raised. Go ahead.
So excuse me, can you hear me?
I can.
Okay. I just want to make sure that I have this right. This 911 Cares Registry program, it's for people who know that they have disabilities and they want to make sure that 911 is aware of them if they get a call.
Correct. Yep,
Okay.
that sums it up.
So we should encourage someone that has a disability to use this.
I would strongly encourage that, definitely.
Okay.
Yep. So, like Emily said, this is, something that we can provide. If somebody's registered in this database, that information comes up right when they call 911. So we can use that information to provide to local dispatchers who can then tell the crews on the road, whether they're in the ambulance, the police cruiser or the fire truck, regardless of what the emergency is, we're going to pass that information along so that they know, exactly what's going to happen on scene, and if there's any way that we can alter the way that the call is handled, or how we describe that to local dispatch.
And so it's, excuse me, it's registered with their phone number and address. So like, obviously, if they were to call, if there was an emergency outside of their home, that information, if they didn't call from their own phone, that you guys wouldn't get the information unless you were told.
So with and correct me if I'm wrong, Emily, so you have to have the address associated, but it's an unlimited number of phone numbers. So if you're out and about and you tie it to, all of the phone numbers that may be with this individual, you can still supply the address of where that individual is. And our dispatchers will still be able to see that information as long as regardless of location, as long as you're still calling from one of those phones associated.
Perfect. Thank you.
You got it. Anybody else?
Annette, did you have a question? Sorry to call you out, but I thought you had unmuted before.
Oh, yeah, thank you. Years ago when this first came about, there was a lot of concern about people with mental illness and having this registry. Are you finding that people are using this form to register themselves? I don't know if you have access, because I came on late. I'm sorry, we had a client emergency. But I don't know if you have access to like all the data of all the forms that come through, but is it being used to share information about people with mental illness?
Yes, I can answer this. Yes, so people are registering themselves. We have access to all of the forms that come in, so we can see what information. We do review all of the forms that come in. But yes, it is being utilized. We do have actively around 1,000 registrations right now that are in. So
that's great. And is that so when the police department is contacted or the response, that information is given so that if they have trained officers, CIT trained officers or, emergency response trained officers for someone that might be having a mental health crisis.
Yes.
It's something that then you let them know.
Yes, so we will relay the CARES information to the local dispatch. So we do pass that information on. And then we also, some of the registrations I've seen have come in that people include calming techniques. Like if a mom is registering her
good.
child, she'll include some calming techniques so that that can be passed on to the local dispatchers as well. So
That's great. Wonderful. Thank you.
yes.
So while people think of any other questions, I will say I can pass along a copy of the PowerPoint as well as all of the outreach materials that were shared. So we have an FAQ, we have kind of an informational handout. So I'll pass all that along through Emily, who can then distribute it to everybody on this call here. But with that said, any last questions?
I guess that makes me think of one other thing. Sorry, is that are there parts of the state or areas of the state that are not taking advantage of this program that you're trying to promote it more within? Are you feeling like most of the state is that the majority of emergency response police departments, etc., are getting this information out to their community? Or
I think there's, and I'll let Emily speak to it too, but I think there's always room for improvement. I think so. The revamp from Supplemental Alley to 911 Cares has only happened, over the last year or so.
Okay.
So I think 1,000 is great for 1 year. Do I want to see that number jump to 10,000? Absolutely. So I think there's room for improvement across the state, and in any way that we can work with you or you can work with us to boost those numbers. I'm always happy to jump on these types of calls or come in person for a presentation. So always happy to help you, and certainly would appreciate if you help us with spreading the word.
That's awesome. It's a great program. So I think that we could do a lot around, making that happen to inform the community. I guess I was just wondering if there's anywhere that doesn't accept this. Like, are there police departments that, I don't want you to call anybody out.
No.
But is there resistance? Do you find that there's parts of the state that it might be more resistant to this program, or has it been in general? And I'm sorry if you covered this before because I didn't come in like
Yeah.
that.
Fortunately, I haven't heard of any resistance.
Good.
And quite frankly, if one particular town was resistant to this program, they would still get the information on the 911 call.
Okay. Good.
It's policy based. If the information is in there, we are going to pass it along. I don't see why anyone would be resistant. So I haven't heard of any, and I think this program is great. We may be a little biased, but Emily and I are we like to dive into this, and we've done a lot of presentations throughout the state, and I think thankfully so far the feedback has all been positive.
Awesome.
Yes.
That's great.
And I will just add too, it has been positive. I haven't heard any negative feedback about this. And also even the registration, you don't have to go through your town or local agency to register. So anyone can log onto our website and register. So, and then that is coming to the two 911 dispatch centers. So it is primarily through us. Local agencies don't have a lot to do with it other than receiving the information that we give them.
Good. Okay. That's great. Wonderful. Thank you.
All right. Thank you guys so much. This is